The broadcast is now starting. All attendees are in listen-only mode.
Okay. Hello to everyone. This is David O'Brien. I'm the current chair of the Academic Collaborative for Integrative Health. Thank you for joining us this afternoon. First of all, for a couple of housekeeping announcements. Participants are going to be muted during this presentation. And if you have a question or some thought that comes up, if you will add it to the chat line, we'll try to answer those questions at the end of our presentation. Thank you all for joining us today. This is our annual meeting, and going back, we were just discussing the formulation of this group going back 14 years with some of our folks, and it's really been quite a evolution and revolution in healthcare and where we are today versus where we were a dozen years ago. Let me first start. You have before you the annual meeting. If you're on the web, you can see the board that we currently have and staff that we have pictured here at this meeting. Let me go to the next slide if I can. There we go. I'd like to introduce to you on in the pictures that are before you. We have Alyssa Wasserl, who is our executive director, joined us this year. We're delighted that she has come with us with a great background in healthcare, and having worked with a couple of different groups in our neck of the woods. It has been someone who works in the vineyards quite well and has worked with all of us. We're delighted she's joined us and has made a transition from Liza Goldblatt, who was our interim executive director after John Weeks left us. So we're delighted. The next person, Joanne Yanez, who is the chair-elect for the board. My 2-year term is up at the end of the year. This will be my last official act as the chairman of the board. Dr. Yanez is as a naturopathic physician and a certified association executive. Next, we have Liza Goldblatt with a PhD and a founding board member, former chair, former interim executive director for us, and has been a person who has helped put us forward at the global forum that the National Academies of Medicine, Sciences, and Engineering organization that we work with. Beth Rosenthal has been with us. She's got, as a director of working group, she's been with us for since I think close to the beginning, if not from the beginning. She's been a great resource for us and has really helped with the working groups and keeping those organizations, that part of our membership, working together and doing the collaborative work and fulfilling our mission. And we're thankful for Beth for doing that. Deb Hill, who was with our library SPIG coordinator, has worked with us on a couple of projects over the years, and we're delighted that she's been able to stay with us and help us through this. Last couple of years, as we've made transitions in leadership, it's been very helpful to have a steady group of people who are on staff to help us. That leads me to Renee, who, as the director of operations, has been with us for a number of years, is a great resource, has a wonderful knowledge in the organization and our background. And so some of you from time to time have contacts with any or all of these folks. So I wanted to introduce you all to this particular group that we have working with us from the start. I guess next slide, if I can. Since one of the big changes we did the last couple of years was in our strategic planning process. We wanted to find a capacity to have a national office. We've had virtual offices in multiple areas around the country. When we have a international group like we do, we're always doing time zone changes, and we're we're thankful for everybody accommodating schedules across the day with us. But we had an opportunity with Southern California University of Health Sciences to be providing us an office as the national office on their campus. That's a long time goal that we had, and SCU brought that into fruition with us this past year. Their president at the SCU is John Scaringe, who has not only been at the school for a number of years, he's also been on the executive committee with us as a treasurer, a longtime supporter of the organization and our mission. And that's been a great resource for Alyssa and for the California contingent that's out there close by at hand to have that base for us. So that move to that campus was really a part of our process where we brought on Alyssa as our executive director in the search, and that worked out quite well for us. Liza Goldblatt, who has been our interim executive director and a former chair of ACIH, is for the collaborative. I'm using a throwback here for our prior name. Liza is now, as a founding member, still sits on our board, and we're delighted to have that kind of corporate memory from Liza. It's been a great help for us as we've all worked in tandem as a team, a very collaborative one, for moving the collaborative forward in this new chapter in our lives. So it's been an exciting year for us with so many changes, and we're going to talk about some of those as we go through this slide presentation today. Next slide, if I could. So I want to thank, there's a lot of people who do a lot of work throughout the year for us, and this list here provides our board members and staff for their time and commitment to the collaborative. Our executive committee has been myself as chair, Joan Yanez as vice chair, John Scaringe as treasurer, Dale Healy as secretary, and Stacy Gomes as our executive committee member at large. We've had a number of people who have been on our board for years that have really given us an opportunity to have the continuity that boards sometimes have and sometimes we don't have. And I want to say how pleased I am for everybody that's on the board, and we're all listed by name there. We are just blessed with people who given to us an opportunity to look at that list for a name and list of the names here, and Alyssa as well. And I'm getting sorry for the background noise that I'm getting here in the back here. Sorry, but this is a list of people who are dedicated to our mission, and we're dedicated to really spending time with us in this projects that we have going. Everybody has provided their counsel to us, and everybody has provided their time and energy. I'm very thankful for all their helps. We have the staff listed as well, which we've just run through on the prior site. But I want to really stop for a moment, and we have conference calls quarterly with our board. The executive committee meets monthly. It's taken a lot of time and dedication and effort, and it's paid off in a big way here this year as we move on. Next slide for me. So what we have coming up is our new executive committee for our governance. We have incoming officers this January, so in a couple of weeks, this will be the new executive committee that we have for the organization. We have a good cross section again in the disciplines. I will, with the bylaws change that evidently impacts me, I will be serving as an immediate past chair, but our next year chair will be Joanne Yanez. Dr. Yanez has been on the board for a number of years, and we are very fortunate with being able to really make a difference because of this continuity, and that's been great to work with. Joanne, do you want to say a few words about your incoming group? Should I turn this to you at this juncture for a few words?
Sure. Thank you so much, David. I can't take any credit for anything at this point without acknowledging your leadership. But I am very excited to be the incoming chair for ACIH and steering us through the next phase of our work together. And I'm also really jazzed to have this wonderful team with Dale as vice chair, Stan as secretary, and Beth on as treasurer, and so thankful for you to be staying on as immediate past chair on the new executive committee for 2019, and just very excited again for what we have coming down the line. Thank you.
Great. Now the next line, please. So this is going to be, as we hand this off to other people as we chat, a little bit of our background here. This is the background for who we are, who our membership is. The core members are our Council of Colleges, the accrediting agencies, certification and testing organizations associated with the 5 licensed health professions. Yeah. Acupuncture, Oriental medicine, chiropractic, direct entry midwifery, massage therapy, and naturopathic medicine. We also have a provision for emerging professions, and that includes yoga therapy, Ayurvedic, homeopathy, somatic methods, and other nutritional specialists that are developing as well and looking for certification and licensure. So we have been an open, inclusive body that is embedding what healthcare is going to look like as we move into this new arena and changing marketplace that's welcoming our branches more than they did before. So Alyssa, I'm going to turn it over to you for the next, to go ahead.
Okay, great. Thank you so much, David, both for your service as chair and for this nice introduction to our year in review and our stellar team of staff. Really appreciate that. And welcome to you, Joanne, as incoming chair. I do want to note that on the previous slide, where it showed Joanne Yanez, Dale Healy, Stan Dawson, and Beth Pimentel, those are our 2019 incoming executive committee officers. And we also have 2 at-large members who will be continuing with us, who are very valuable members of our executive committee, and that is John Scaringe and Stacy Gomes. So with that said, although I'm an informal type of speaker, for my first address to the supporters, donors, friends, and followers of the collaborative, please indulge me initially as I speechify just a little bit at the outset of this presentation. So I will be reading from some prepared notes initially. It's my pleasure to have the opportunity to serve alongside the staff, executive committee, board, and membership of this esteemed organization. I'm honored to follow in the very large footsteps of my executive director predecessors, Liza Goldblatt, John Weeks, and Pamela Snyder. It is and has been a year of important transitions for ACIH, as David and Joanne both noted, as my appointment as executive director represents the first time that the ED is a non-board member. This means I've joined the collaborative without the benefit of institutional knowledge on a deep level. However, it also allows me the vantage point of looking with fresh eyes at our organization's mission, vision, culture, governance, and strategic goals, all the while absorbing the lessons and labors of years past, which have resulted in such extraordinary accomplishments for an organization of this size and breadth. Virginia Burden once said, "Cooperation is the thorough conviction that nobody can get there unless everybody gets there," which I believe articulates the inherent message of the collaborative's work in terms of the advancement of complementary and integrative health. Next slide, please. In that spirit, we are a true collaborative, an academic collaborative of councils of colleges, accrediting agencies, certification and testing organizations, as David has noted, along with our TWM and emerging professions, the individual colleges and universities at our side, and the associate and individual members. I'd like to thank our core membership listed here in alphabet soup fashion, which I'm not going to translate for you at this time, but each organization in their own right is a powerful representative of their profession, and we are deeply grateful for your support in our shared mission and vision. Next slide, please. This is a list of our individual college members. We thank you all for your membership and commitment to advancing complementary and integrative health through the lens of interprofessional education and practice. Next slide. Many of you are already familiar with the collaborative's vision and mission, but still these statements bear repeating for their aspirational intent. So I am going to read them. Our vision is this: ACIH envisions a healthcare system that is multidisciplinary and enhances competence, mutual respect, and collaboration across all healthcare disciplines. This system will deliver effective care that is patient-centered, focused on health and well-being, and readily accessible to all populations. Our mission reads, ACIH enhances health by cultivating partnerships and advancing interprofessional education and collaborative practice. We educate, collaborate, and advocate for the inclusion of the values, practices, and disciplines associated with integrative health, and in particular for collaborative, team-based, patient-centered care. Next slide. So our ACIH values are listed on our website, and they have nuggets of gold in them. So I do encourage you to read them on your own if you are so moved. But paraphrasing here, equity and access to the disciplines and patient-centered care, a system that is inclusive and which values all evidence-informed practices, and which supports diversity and traditions. Summed up nicely by the IOM statement at the bottom of the slide, the goal of integrating care should be the provision of comprehensive care that is safe and effective care, that is collaborative and interdisciplinary, and care that respects and joins effective interventions from all sources. Next slide. Our CEDR. This slide is literally a bookmark about our CEDR. Many of you are familiar with this ACIH publication, which is now in its 3rd edition, the Clinicians and Educators Desk Reference on the Integrative Health and Medicine Professions. This is available in print, in EPUB and Kindle formats, as well as in PDF, and more information is available at integrativehealth.org, our website's URL. Also of note is our concerted effort, which will be advanced in 2019, to increase distribution and circulation of the CEDR to academic medical center libraries, as well as via our member schools, to increase visibility to our professions. Next slide. So at this time, we'll be moving into our project review and into some detail, and as such, it's my delight to introduce founding board member and my immediate predecessor and previous chair, Liza Goldblatt.
So good afternoon, everyone. I am delighted to be here. I'm coming on via phone, so I will count on Renee to tell me if there are any technical issues. So one of the main goals of what we now call ourselves often the collaborative was to be sure that we were able to obtain seats at national table. And I just want to remind people that I'm sure you remember it, but in 2010, there were 2 really seminal publications. One was the Lancet report on healthcare professionals for the 21st century. And it really talked about the importance of team-based care, patient-centered care, and working collaboratively and teams being inclusive. And also the importance of people being willing to be change agents. Another publication that was so important in 2010 was called The Future of Nursing. And this really talked about many areas, but one area in particular that many of our disciplines can relate to is really providing the environment in which nurses could practice up to their full scope of training, their full scope of practice. And that was in 2010. And then some of you remember that in 2011, the IPEC competencies came about, the Interprofessional Education Collaborative. And it focused on what all health professionals should know in mainstream healthcare. And right away, our previous executive director was calling IPEC and indicating that we would like to be part of this movement as well, representing the complementary and integrative health care professionals. And fast forward, I think that started with 6 members, and it's now up to 30 members, and we do have representation involved in what's called IPEC. Directly from those 3 areas, those 3 movements, in 2012, the then Institute of Medicine created the Global Forum for Innovations in Health Professional Education, now called the National Academy. I'm assuming that you're on this slide, Renee. So the national, it was upgraded, the IOM was upgraded to the National Academy. So we have actually moved into our 7th year. We joined when they first opened up, along with 50 other national organizations. We've now moved into our 7th year as a member of the Global Forum, which is quite amazing. Every health profession in the U.S. is basically at the table. We are there as the one organization representing complementary and integrative medicine and health. And for about the last 4 years, and this was John Weeks and myself, we really decided to focus on pushing out the importance of individual resilience, health, and well-being. As many of you know, we had a lot of publicity in the last several years about the amounts of suicide amongst residents, the amount of burnout, about 52% of health professionals representing or having way too many signs of burnout. And also, our disciplines have focused for many decades, if not centuries, on the importance of disease prevention, health, and well-being. And about 4 years ago at the Global Forum, a small group of us actually just started meeting at the Global Forum on our own, and then it became like a subcommittee on how can we actually bring this to the table, the importance of disease prevention, health, and well-being. And next slide, please. And so finally, much to our amazement, meaning the collaborative as well as John and myself in particular, as we were the people attending this Global Forum, they actually decided to hold an entire workshop on this specific area. So John and I were both on the workshop planning committee, and we were extremely pleased that it included Mary Jo Kreitzer, who, as many of you know, is a consortium leader, included other people that were both from the consortium and the collaborative. John and myself and several other people were there at the April meeting, and the feedback from it was that it was extraordinarily well received. And the nice element now is we are seeing that phrase of building resilience, health, and well-being pretty much embedded in most of the workshop of the Global Forum. And in November, David O'Brien was able to attend the Global Forum meeting, which focused back again on the importance of interprofessional education and of it being collaborative, and working with that gap between education and moving into actual practice. So another thing happened at the April meeting, which is many of you are familiar with the flyer, Moving Beyond Medications, that was created by all 4 organizations. And basically, we brought in Margaret Chesney to present on that flyer. And what happened again was this national crisis about the overuse of opioids. So there was a decision to make what's called an off-cycle workshop. Forum for Innovations in Health Professional Education. And there's excellent documentation and videos of all the previous workshops. So now moving on to the slide that is entitled The Role of Non-Pharmacological Approaches to Pain Management. A workshop just occurred in DC that was really quite amazing. I was there, David was there, Alyssa was there, several members of our disciplines were there, several presented, and several members of the consortium were there and several presented. It was co-hosted by a forum on neuroscience and nervous system disorders. And basically, this workshop had three different sections. The first one was on research, safety, and evidence. And it took up most of the first day. There was a tremendous amount given. And all of our disciplines were mentioned several times because, again, for many decades, if not centuries, we have taken a lead in this particular area. And the second part of the workshop focused on education and training. And again, we talked a lot about the importance of team-based work when we're focusing on the non-pharmacological treatment of pain. Excuse me, one moment. I did catch a bit of a cold on the plane. Anyway, it was a superb workshop. The last part of it focused on policy and the importance of how we really have to change policy to both reimburse for the issue of building resilience, health and well-being, and also for teamwork. Because most frequently, the kind of treatment that works the very best on the non-pharmacological treatment of pain is really team-based work. So the next slide, please, about the Global Forum, the January 11th meeting in 2019. So very interestingly, we got such excellent feedback on the April meeting that focused on resilience, health, and well-being. For the first time in my knowledge, the Global Forum is going to hold a half-a-day meeting on this coming January 11th, 2019, and it's going to have two areas of foci. One will be, again, on the whole issue of burnout, stress, and well-being, and we'll bring in some of the most interesting reports from the April 2018 meeting. And we're also going to be talking quite a bit about the next workshop, which will be in November of 2019, which will be on the social determinants of mental health and mental health disparities. Again, I think we all know when we're dealing with chronic pain and issues of pain and so many healthcare issues that the social determinants and the area of mental health are very key components. We will have that agenda up on our website probably within the next 4 or 5 days. And so we'll be sure to let you know when that comes forward. So the next slide on the Consortium Collaborative course. I think many of you have heard for a while, including in our newsletters, that we are now working with the consortium on creating a 36-hour hybrid course. And the of it will really be threefold. One is to focus very specifically on training all the disciplines we represent so they can come in with a baseline knowledge about the entire mainstream conventional healthcare system, both inpatient and outpatient settings. And then it will also include a module, again, a basic training module for all health professionals on interprofessional education and collaborative practice, because many of the clinicians who are already out in the field may not have training in this area. And the last area, which is not a small area, it was brought up again at the December workshop, is that many of the mainstream conventional medicine practitioners, still could really gain more knowledge and understanding of the depth and the breadth of all of our disciplines. So we would have a module on that. If we can go to the last slide, all presenting. We have put together our leadership team, and you can see them there. I'm sure you will recognize many individuals. I already mentioned Margaret Chesney. She's the first picture. Mariana Clott worked on the University of Arizona project, where we developed the National Course in Integrative Health. Ray Teets was the former chair of the Education Working Group, but very involved in the social determinants of health still, and very involved in the consortium. And then we have from the collaborative, Iman, who you all know, Bill, and myself. And Bill Egloff of Craner was a tremendous supporter of our initial development of this project, and NCCOM as well. We have a $40,000 matching grant, and right now the consortium, just as we went through a lot of changes in the beginning of the year, The consortium is now going through some transitions, but we hope that by the beginning of next year, our leadership team can come together and really look for some potential funds to actually support this project so we can move forward. So the last thing I want to say is it's been my great pleasure to work with the whole executive committee and especially David O'Brien. As you know, the chair and the EDs work very well together. And one thing David didn't mention is that he was a vice chair when I was chair. So I know how much time and care, and I would call equanimity, David has contributed to the collaborative. And I just also want to express my personal thanks to him and again to the entire collaborative board and staff. And I know our entire community has really devoted itself to how do we make our disciplines much more accessible to the public. And I do think the Global Forum is one way we really are doing it, as well as our work with the consortium. So thank you very much, Alyssa.
Thank you, Liza. Just a quick note that Joanne Yanez, our incoming chair, was also able to be in attendance at the Global Forum workshop last week in DC. And indeed, it was a historic event for our professions. And the first time that I was on site, it was very exciting for me. Next slide, please. So I'm going to just show you a couple of slides here that are actually related to the Global Forum workshop in sort of a tangential way. While at the Global Forum workshop in DC last week, and when the discussion was around implementation about non-pharmacological approaches to the treatment of chronic pain, it was notable that the concept of imparting knowledge of self-care, healthy habits, and health and wellness to our youngest citizens, starting in pre-K, was mentioned repeatedly as a necessary step toward the advancement of our mission and vision, the mission and vision that we all share around integrative healthcare. And to that point, the Collaboratives Board had previously, in our meeting in Baltimore, our initial meeting, our annual in-person meeting, had expressed interest in this project, the Project for Whole Health Learning in K through 12, a project led by Taylor Walsh and Dr. Larry Rosen, pediatrician, to integrate wellness activities into K through 12 education. Next slide. You can see by the density of this slide that the project represents a comprehensive approach to preparing future generations to succeed via health-promoting curriculum and education, and expressed through a holistic umbrella of school gardens, food and nutrition literacy, nature and outdoor education, mindfulness and movement. So in order to help stem the tide of childhood obesity, the effects of adverse childhood experiences and stress and nutritional depletion. So this is a project we'll be tracking closely and which you can check out at wholehealthed.org if you're interested, and we'll report on this in 2019. Next slide. Conferences and collaborative efforts. Now we're getting further deeper down into the details of our work in the past year through 2018. Next slide. And just a bookmark here about our intentional engagement and dialogue and partnership activities with each of these organizations, both in the past and in the present. The Academic Consortium for Integrative Medicine and Health that Liza just spoke to in regard to the partnership that we have with them with this hybrid course that we're developing, the Academy of Integrative Medicine, the National Center for Integrative Primary Healthcare, the Integrative Health Policy Consortium, and of course now a very significant connection to and relationship with the National Academies of Medicine with the Global Forum. Next slide, please. Some of you have seen this before. This is a wonderful infographic, moving beyond medications, a nice example of the collective synergies between the other organizations, AIHM, IHBC, and the Academic Collaborative. And this is available on our website as a PDF. Next slide. So I was able to attend the second annual Integrative Pain Care Policy Congress in November in Boston, Mass, on behalf of the collaborative. And this is an invitational event that is hosted by the Academy of Integrative Pain Management and IHPC, or the Integrative Health Policy Consortium. And this was a significant, important meeting that included invited representatives from 70 different organizations, including the executive branch listed there, FDA, CDC, HRSA, CMS, NCCIH, and VHA, and other agencies, including the VA and the DoD, patients, research, payers, and the full scope of providers about integrative pain care and policy around it. I served as a member in this year of the Strategic Communication Working Group, and plan to continue that in 2019. And there are ongoing task forces hard at work related to last year's event and the continuity that they have now with this event will continue. Go ahead. And here's a picture of the 70-odd-ish people that were there. Please go ahead. Okay, COMTA and ACIH joint webinar. We took a novel approach to membership recruitment this fall with a joint webinar between COMTA, the Commission on Massage Therapy Accreditation, and ACIH, which was produced specifically for the massage school audience about the benefits of membership in either COMTA or ACIH or both. And leadership from both organizations spoke. We had Don Hogue, COMTA's executive director, along with COMTA's chair, Cliff Korn, and ACIH's Dale Healy, soon to be our vice chair on the executive committee. He wore both hats as a speaker, as he's also a commissioner with COMTA. But I'm sharing this slide because this is really represents an outreach model that can be replicated for other professions and is reciprocal in its intent of expanding membership for both organizations, if that's something that the member is looking to do. In this case, COMTA is a core member of ACIH. Next slide. Okay, so now I'm going to pass the baton to our Director of Working Groups, Beth Rosenthal, who will speak to the various conferences she has attended over the year as a representative of the Academic Collaborative, during which she has made multiple presentations, and she'll also speak to the projects of the ACIH working groups. Beth has worked with ACIH in key capacities and roles over the past 11 years, and it's been a privilege to work alongside her this year. She's a master facilitator with our working groups. And I also want to appreciate the commitment and dedication of our working group members in research, education, and clinical. So thank you to you all. Beth?
Yeah, thank you so much, Alyssa. And now we'll embark on some of the conferences that we've been at. And here we have a picture of our very own Dale Healy. Dale and I presented at the Academy about hospital-based massage therapy competencies, which is one of the projects of our working groups. Here's some other activities at the Academy conference. We had an exhibit table, and we see Alyssa and I there. We had 2 posters in the poster session. So there, on the left, you see Dale and myself, competencies for hospital-based massage therapy. And then on the right is a project on interprofessional collaboration among integrative health and medicine providers, a research study. I was also present at the Integrative Medicine for the Underserved conference in Washington, D.C. this summer, and got to get there a little bit early and have some fun with Deb Hill, another staff member. And here we are. We actually had 2 sessions there. We had a 3.5-hour pre-conference session about interprofessional leadership in integrative health and medicine. And then I gave an oral presentation on the same topic that you saw the poster in the last slide. Here we are at the Healthier Texas Summit, where I was on a panel, again, speaking about integrative health and medicine leadership. Just this past month, there was the American Public Health Association, APHA, in San Diego, and we were very well represented there. Both on the left is a picture of a roundtable session, which was very interesting. It was a 90-minute session with 10 tables, and people could rotate to different speakers every few minutes. So we had got to have a wide exposure to a lot of people. And then in the middle and right slides, it was a session meeting for the integrative health folks, and you can see Stacy Gomes, one of our executive committee and board members, who was also in attendance. Now I get to talk about our working groups, and as Alyssa had mentioned, we have the clinical education and research working groups, and these working groups were formed to carry out projects and tasks aligned with and furthering our mission. Each of the working groups right now meets approximately 5 times during the year. That fluctuates from year to year, but that's what seems to be working now. And the membership on the working groups is comprised of up to 3 members from each of our core disciplines, and that count doesn't include board members or co-chairs, plus up to 3 members from our traditional rural medicine and emerging profession member organizations. And our members are typically educators who are connected with schools that are affiliated with one of our disciplines. Quite often during these meetings, we have presenters come in and speak on a topic, and then we have discussion. And when we do have presentations and discussions, we record them, and then they're posted on our website. Right now it's under the resources tab, and you can just look, and I encourage everyone to do that. We have a wealth of information for many, many years there. And one of the series of presentations and discussions is about integrative clinics, and that you'll see that is the first listing here on our description of some of our smaller project groups, which are part of the working groups. So in the integrative clinic webinars, we have presenters who talk with us about their own integrative clinics and factors that have helped them and challenged them, and then we have time for discussion. So those are really interesting webinars recordings to go and take a look at if you're interested. And some of the other projects we have going on right now is the hospital-based massage therapy specific competencies, which I have already mentioned. This team created and is now in the process of disseminating these specific competencies for hospital-based massage therapy. We have another group working on bridging the research gap between educational institutions. Another team is putting together a systematic review of integrative health and medicine for under-resourced populations. And we have another team that's been hard at work with coming up with some great ideas that is really helping us to disseminate the products that come out of working group projects. That's a very brief summary of all the work that our working group members do. You can go to our website under working group tab and take a look and see who our members are and where some of the openings are. And if you have an interest or you know of someone who might make a great working group member, please contact me. And that's it for my report. Thank you.
Thank you so much, Beth. That was wonderful. And I'd also like to just take a moment to thank the Academy of Integrative Health and Medicine, AIHM, for granting us exhibit space and meeting space at their annual conference, which Beth had some pictures of, and which a number of us were able to attend. And also to Planetree, which through Dale Healy also provided us with exhibit space that we were able to have some visibility to our work. So now we are going to hear from Deb Hill. Deb has worked in various capacities with ACIH in the past, and we're fortunate she is leading our library SPIG, or Special Interest Group. Deb?
Great, thank you. I'm glad to join everyone today. So I am continuing to work as a coordinator for our library special interest group, which is now in its second year. And this group is open to library staff from all of our member institutions, programs, and schools. And it's really designed to help connect member libraries in order to exchange information, learn from each other, or share resources, all with the end goal of supporting the librarian role as a facilitator of evidence-informed practice. So we usually have 2 meetings a year, and we had 2 in 2018, both in March and in November. And normally our group presentations and meetings are closed to members only. But in March, we had a really wonderful presentation from the library staff at Bastyr University that looked at some of the challenges to complementary and integrative health research quality and retrieval. So due to this broader topic, which kind of touches upon even our own research working groups, as well as libraries outside of the collaborative, we decided to open up that meeting and make it more public. And so we did record that meeting. It is freely available on our website underneath the archived webinars area, and I encourage you to check it out if you're interested in this topic. And that's it. We're looking forward to some great presentations that we have lined up already for our March meeting in 2019.
Thank you, Deb. Next slide,
Thanks.
please. So 2019 looks very bright for ACIH as we move forward with the continuation of our groundbreaking work with the National Academies of Science, Engineering, and Medicine's Global Forum on Innovations in Health Professional Education, which we heard about from Liza Goldblatt and also David O'Brien. The Consortium Collaborative Educational Project on the hybrid course will continue to move forward, as will various projects of our 3 ACIH working groups, Clinical Education and Research, as outlined by Beth Rosenthal. And in particular, we are also be promoting our work to individual schools not yet a member, with a goal of expanding membership in the collaborative. For truly, we are stronger together. Next slide. None of our progress and impact would be possible without help from various donors, who I'd like to acknowledge here. An anonymous foundation donor for our Global Forum work, which helped us lay a strong foundation with a seat at the table during a critical time for our professions. Crane Herbs and Bill Egloff for their support of our 2018 annual meeting and a development grant for the Consortium Collaborative Project. IAYT, or the International Association of Yoga Therapists, a longtime and leading member of ACIH in the TWM, or Traditional World Medicine category. Thanks to the Leo S. Guthman Foundation for their steadfast and profound support over the years of various ACIH projects and initiatives. To NCC AOM, a core member of our collaborative and who has sponsored numerous important projects. NCC AOM, the National Certification Commission for Acupuncture and Oriental Medicine, and also supported the initial development and ongoing development of the hybrid course with the academic collaborative. For NCMIC, the National Chiropractic Malpractice Insurance Company, and their multi-year support of our work. We're very grateful. The Foundation for Chiropractic Progress for their sponsorship of ACIH at the Non-Pharmacological Treatment of Pain workshop with the Global Forum last week. We are very grateful having had the opportunity for that sponsorship and to have the visibility to our professions through it. It's a wonderful outcome. To Visual Outcomes for their support of our annual meeting in 2018. To an anonymous corporate donor for the hybrid course. Many thanks for their support of the development of the course. To Healing Centers United for their support during our match challenge this fall. And the same to O'Brien and Company. Thank you so much for your generosity. To our many other donors at all levels, unnamed here, but deeply appreciated for their generosity. For without your individual and collective support, ACIH could not carry out the mission and vision of the organization. So much gratitude to all of you. And next slide. So for those of you interested in supporting our work or becoming a member, we welcome you. Our site is integrativehealth.org for more information. We have multiple membership opportunities, sponsorship opportunities, and so on. And just before we go out, and I think David's going to take us out, a special thanks to Renee Clugston, who's directing this webinar and is a wizard in all ways for us behind the scenes. Thank you, Renee. David?
There I go. I'm on. I had myself on mute. Thank you very much for all of you for hanging into this end of the year. I also want to take the opportunity. We have, and I think Marcia, you're a departing board member for the ACIH this year. You've been a longtime board member. I want to thank you for your support. You've been on committees and chaired some working groups and been on the board. I want to thank you for all of your time and effort working with us. And as you leave the board, thank you for that work. And I know you'll be continuing to support us in other ways. For all the institutions that came up and supported us, it's incredibly important and helpful to know that we have your support. And when we have particular issues that pop up, your expertise just gives us the information we need in order to make a difference. Just want to give you an idea of how exciting the year end was with the Global Forum. In a conversation where we probably had a dozen different people participating in a conference that 10 years ago we wouldn't have been part of. And with the leading researchers in the country attending that conference, and the kind of information that they understood and the comments about the research in our fields, it was very heartening to see where we've come. And you have to take a moment and take stock of the progress where we've seen this. And those of you who have supported us over the years, that kind of vision to look out and look at where we want to be, and being able to put some dollars and time and effort into the mission has made a difference. And it is leaving us in a good place in 2018 and setting us up and teeing off for a good year in 2019. I want to thank everybody for being on the call today. Thank all the staff and the board members, the executive committee. I look forward to working with all of you in 2019, and happy holidays to one and all in this season. We have a lot to be thankful for. And that's it from me. So with that, we will wrap up. I didn't see any other questions or whatnot, so I will head out and look for everybody to have a great holiday season. So at this point, we'll end up this call. Thank you so much for joining us. And thank you so much for being part of the collaborative's life during 2018.